Hello, welcome to another episode of Essential Implementation. I'm Dr. Christian Hudson. Today, we're going to talk a bit more about knowledge mobilization, a little bit about what it is, why it's quite difficult for people to define a lot of the time. But then also a key question I keep having is how can I actually integrate it into my organization? So if you are someone who wants to know what is a good knowledge mobilization strategy, whether it's across a health system, your team, your organization, please stay tuned and enjoy. So knowledge mobilization, it really does remain quite a difficult thing to define at times. And we're going to look at the reasons for that in a minute. But just to start with, I will try and come up with a definition here. So I think one definition a lot of people would agree with is that knowledge mobilization is the process of creating, sharing, and applying knowledge to achieve practical and impactful outcomes. So this is really capturing, it's a process. It's not just about taking knowledge from one place and putting it in another. It's also about creating knowledge, sharing it, and applying it. So its purpose in public health is to bridge the gap between research, policy, and practice to address complex causal public health challenges. The goal here is to enhance public health outcomes by improving the flow and application of knowledge. So if you're looking across a public health system, how well is knowledge and information flowing throughout that system? And in theory, if it's flowing well, and you have some effective knowledge mobilization practices and strategies in there, you're going to get better public health outcomes. Now, what makes it quite difficult to pin down, and it is a hot topic at the moment, there's been a lot of discussion around this, but the ways in which knowledge mobilization, or I might use KM in this video, by the way. So if I say KM, I mean knowledge mobilization. The ways in which KM is theorized and operationalized can vary widely. And this is because, it really draws from a lot of different disciplines and often different paradigms. Management science, public health, education, and sociology will all bring distinct assumptions about how knowledge is created, shared, and used, and often impact your KM. So, for example, organizational studies will often talk about the importance of context. Sociology will highlight the relational nature of KM. And public health will highlight the value of co-production, just to give you a few examples. KM can draw from many different disciplines, which, depending on which you use, will affect what it is like. But it also draws from different paradigms, which are more fundamental. So there are linear models which emphasize knowledge creation and dissemination as sequential steps. So it's mechanistic, it's linear, step by step, or interactive models which highlight this co-production and iterative engagement between stakeholders. So depending on which paradigm you're using, that can also fundamentally change how your knowledge mobilization is going to look. So it really is shaped by a blend of theoretical paradigms and disciplinary approaches, and should be tailored to the specific context the KM is in and the challenges of that sector. Now, if you are creating a knowledge mobilization strategy, maybe you're writing this into a bid, or you're trying to decide how to bring knowledge mobilization into your system, you want to think about what paradigms and disciplines you might want to draw from, and there's plenty out there. But there's one which I think is often missing from people's KM strategy, and which I think if you use it can seriously bolster the effectiveness of your KM. So what is that? Well, it's systems thinking. What is systems thinking? It posits that the world is comprised of complex systems which are dynamic, interconnected, and evolving, and cannot be controlled. So the idea is we've got to better understand the complexity if we are to affect desired change. And a system is a perceived collection of interrelated but independent parts that are linked by a common purpose, and through their interactions function as a whole. So there'll be a range of actors, activities, and settings that appear to have direct or indirect influence on any given situation. If you think about this diagram here, if you imagine a green circle is maybe your knowledge mobilization. You're trying to do this in a certain context. There will be certain people in that context and involved in the knowledge mobilization, and there'll be a certain approach to it. And all of these will be ever changing in unpredictable ways, but also affecting each other in unpredictable ways. So this is a kind of a very rudimentary way of looking at a complex system. There's also these other aspects that you can read about. So nonlinearity, path dependency, adaptation, interconnectedness, and fuzzy boundaries and unsolvable paradoxes. But I suppose what's really useful, and one thing that's really I find really useful about complexity science and kind of systems thinking, is that it can separate things into simple, complicated, or complex. So if you're working in a system that's relatively simple or / complicated, or maybe the problems it's having to face are simple or complicated, then your KM strategy could probably be quite linear in a way, because this is a relatively knowable situation. So you might have a linear KM strategy, and you might have relatively fixed outcomes that you're trying to aim for. But in a more complex system where, things are a bit more non-linear and dynamic, you're going to have to adapt to problems that you've never predicted in real time in response to feedback And this can often undermine kind of logical efforts to bring about change or bring about knowledge mobilization. So in these kind of systems, if you're in a complex system, systems approaches to knowledge mobilization are likely to be most valuable because they invite a multi-perspective emergent view of the phenomenon. I think what a sort of more interactive, complex paradigm allows us to do is really take hold and acknowledge what's the reality of the context we're trying to mobilize knowledge in. So systems thinking really adds value because it offers productive ways of understanding and working with the multiple complexities that knowledge mobilization strategies face. And you might say, what are these multiple complexities? Well, in a public health system, it's kind of like, what's the health problem? So, broken arm is a lot more simple than, say, treating dementia. The policy and practice environment we're in, well, as I say, you look at any health system, generally very stretched, low resources, high staff turnover, and trying to implement a million things at once. So that adds a lot of complexity. There's always the wider system around it. So, there's the politics around it, the politicized decision making, power dynamics. So all those things will add to the complexity. And a very nice framework, I've talked about this in another video, is the NAS framework, and this kind of really highlights these areas of complexity a lot more. So if you look at that video, but each of these things, each of these areas of a system can be simple, complicated, or complex. And the more complex they are, the harder it will be to implement, adopt, and sustain something. And it's the same with knowledge mobilization. There'll be aspects of this which will apply to that as well. So can systems thinking help us with our knowledge mobilization strategy? Well, I think it already has started to. So there's evidence that we're moving away from linear to something deeper, right, in our approach to knowledge mobilization. First thing you might notice is the dominant conceptualization of how knowledge is shared has started to change. I mean, I'm definitely seeing this, that instead of the models, we are seeing more multidirectional and complexity attuned approaches where knowledge is produced and becomes meaningful through social processes. There's also the literature has been moving in this direction a little bit over time. So there's literature on Mode 2 knowledge production, a work by Graham, Ward, Nutley, Holmes, and others, emphasizes that knowledge is not independent of systems, processes, or people, and that context, co-design, power relations, and different ways of knowing are all key constructs when it comes to KM. You also see this evolution of terminology. So we had like transfer, translation, exchange, diffusion, integration, now mobilization. I think that illustrates a kind of shift in how we're seeing KM. And also, there's a much more of a focus now on knowledge rather than just research or academic evidence. So we're seeing knowledge as a much broader construct. So it's already systems thinking is getting into knowledge mobilization, but I think it can go a lot deeper than this and bring a lot more power to your knowledge mobilization strategy. So what might a general systems approach look like when it comes to KM? So if you read Haynes et al. 2020, a very good paper, do check it out. It talks about leverage points for changing complex system. So it's saying when you're coming up with a knowledge mobilization strategy, you might look across the system and see which points you might be able to leverage. Okay, this can be also used if you're trying to bring about some kind of transformational change or implement something. So there are different levels, right? There's multiple levels to a system and multiple leverage points that you might target. As you move up this framework, if you say manage to leverage the goals of the system, that will be more effective than leveraging actors and elements of the system right down here. But of course, as you go up, you get decreasing levels of accessibility. So trying to change the goals of a system or the paradigm is a lot harder than trying to change, say, the feedback or the relationships and power. So what here systems thinking is helping us think, well, what points in the system can I leverage to increase my knowledge mobilization success, right? So if we start down here at the actors and elements of the system, right, this basically means the people, organizations, even the system resources, tools, and knowledge. It also includes the day-to-day practices and behaviors of individuals who use or create knowledge. So this is the easiest part of the system to really intervene in, but it also has the least long-term impact if not supported by higher system changes, as we will see. So implications for knowledge mobilization, if you're going to try and leverage this aspect, is you might focus your efforts on providing training, resources, and access to knowledge. But as I say, if rules, power, goals don't support the knowledge use, it's not going to make as much difference as you might like. So strategies here might be ensuring practitioners, policymakers, and researchers have the necessary resources and training to do KM, promote open access knowledge. So you might increase accessibility. You might support professional networks and learning communities for sharing best practices. We do a lot of our interventions at this level too. We try and change individuals' behavior, or we try and bolster resource, or we bring in new teams. But again, they always come up against system barriers, and these are the things above. But it doesn't mean you shouldn't also do some stuff here, but it means you probably also need to go in at some of these other leverage points as well. So feedback. Well, feedback loops shape how information circulates and how decisions evolve. So systems rely on feedback. So positive feedback loops will reinforce trends. Negative feedback loops will stabilize the system. And the implications for KM here is that effective KM requires strong feedback mechanisms, right? So you need your knowledge producers to be interacting continuously with users. If that isn't happening, it won't go so well. Feedback also is important, is if you're trying to implement in a complex system and you come up against complex challenges, you need to adapt. And so there needs to be adaptive learning systems in place. Otherwise, your knowledge will get lost, could fail to impact decision making. So, if you wanted to leverage this aspect, you might create real-time monitoring systems to track knowledge use. You might establish continuous learning cycles, so findings are refined through feedback. You might use knowledge brokers to facilitate feedback between policymakers and researchers. So lots of juicy stuff you could do there. Relationships and power. Well, if you work in a public health system, you know that the system is shaped often by power dynamics, trust, and relationships. I talk about this in my other videos, that this really does drive implementation. It also drives knowledge mobilization, and power influences who decides what knowledge is valid and who gets to use it. So your implications for your knowledge mobilization is that it's, knowledge mobilization is political, right? Some voices can be prioritized over others. If power remains concentrated among a few people, teams, institutions within the system, KM will actually reinforce existing inequalities. So you really want if you're going to leverage this aspect, you want your strategies to shift from knowledge transfer, so this top down, here's the knowledge you're going to use, to co-production, collaborative knowledge creation, work with people all throughout the system. Also, empower those marginalized voices, empower them in the knowledge mobilization and in decision making, and strengthen trust-based relationships between researchers, practitioners, and policymakers. We're getting higher up now. So the more we are able to leverage these points, the more effective, but then also the harder the access. Now, structures and rules. So again, this is the laws, the policies, the institutional norms that shape how the system operates. Structure determine who is accountable for using evidence and how decisions are made. So even if individuals want to use knowledge, rigid structures and outdated policies could well prevent change and knowledge use. KM must embed knowledge use into governance and decision-making structures. So your strategies here might be things like requiring evidence-informed policymaking in government and organizations, changing funding models to prioritize research impact over publication count. We're doing a lot of that at the York Chamber Applied Research collaboration, and support organizational learning cultures that integrate KM into everyday practice. Okay. Goals, we're getting even higher now. System goals define what the system prioritizes. So these shape all the other levels. So if knowledge mobilization isn't a goal, resources and policies simply won't support it. So we could be trying to put all these things in place down here that promote knowledge mobilization. But if it isn't a goal of the system, we're going to come up against that as a barrier. So you really want your KM to align with broader system goals, such as sustainability, equity, or social justice. Many KM failures happen because the system prioritizes other objectives, like cost-cutting, other evidence use. So your strategies here, you might reframe KM as a core function of the system, not just an optional activity. You might align research funding with, again, real-world impact and policy change, and shift academic culture, again, from publication-driven to impact-driven research. So let's look at the final stage of this, the paradigm stage, the hardest one to leverage, but also the one with the most leveraging power. You can change the paradigm, potentially can change the whole system, everything below. It's a lot easier to do that, but very difficult to do. So paradigm of the system is its deepest set of beliefs, values, and assumptions. Paradigms shape what is considered valid knowledge and how society defines progress. So a lot of KM efforts fail when they challenge rules and goals, but don't change dominant mindsets. So again, think about the paradigms we spoke about before, about those two different ones with KM, the linear models and more interactive models. If the system still sees KM as a linear thing, right? A linear step-by-step mechanistic process of taking the product of knowledge through a pipeline, putting it into practice. If it sees it like that and doesn't see it as an interactive process, as a social process, that's going to change how successful your KM strategy is when it comes up against complex challenges. And even if you aligned goals and the structures and rules and feedback and these other levels. If the paradigm still sees it as linear, that's going to be a problem. So paradigm shift really does require changing how people think about knowledge, mobilization, and decision making. So your strategies here, you might move from, again, you need to move everyone from this knowledge as a product to knowledge as a process. You've got to encourage continuous learning, recognize there's multiple ways of knowing, right? There isn't just academic knowledge. A lot of the time it's like, well, is there a randomized controlled trial for this? Is it an evidence-based practice? And yeah, these are very useful and very important. We need to know things are effective and safe and they've been proven to be. But indigenous knowledge, lived experience, these are also really important aspects of knowledge. We need open, self-organizing knowledge systems that are resilient and adaptable. So another paradigm needs to acknowledge how whatever our KM strategy is, in the face of a complex system, it will have to change and adapt in the face of that. So we can't be too attached to, this is our strategy and we're going to stick to it. We're going to continuously learn how to improve and pressure test this strategy. So I've tried to do it as quickly as I can in as useful way as I can, show you one way we can use systems thinking to bolster our KM strategy. Now, is there anything else that might help us apply system thinking informed KM strategy to our health system, our organization, team, whatever it is that you're working in and want to do this with? This is a great paper. I would recommend it. Now, what the authors of this paper did here is they mapped the knowledge mobilization landscape in healthcare in the UK and internationally. They also looked at social care and education in the UK. So they worked inductively from the study data and derived 8 key archetypes or bundles of knowledge mobilization activities that could be used by teams. So what they've produced for us is 8 key archetypes of knowledge mobilization. You've got producing knowledge, brokering knowledge, intermediation, advocating evidence, getting research into practice, researching in practice, fostering networks, and advancing KM. This is useful because these are the KM practices that we could use to leverage aspects of the system using the leveraging model we just looked at. So I don't want to spend too long on this because I don't want this video to go on too long, but what is producing knowledge? So this is what a lot of us are very familiar with. So, generating and disseminating research-based products like empirical studies, systematic reviews, and knowledge summaries to derive evidence-based decision-making. So all that academic knowledge is going on outside the system and then it's being fed into it. So it's producing the knowledge. There's brokering local research. So this involves facilitating tailored dissemination and engagement strategies to support the uptake of new, locally produced research within specific contexts. There's brokering existing research. So taking the stuff produced in number 1 and concentrating connecting wider bodies of established research with policymakers and practitioners to enhance evidence-informed decision-making. There's advocating evidence. So you might have a comms team that use education, social influence, alliance, policy framing to champion the use of research in decision-making, reduce barriers to evidence-informed action. Getting research into practice is another one of these KM activities, focusing on applying external research to local practice, then adapting the findings to fit specific organizational contextual needs, researching in practice. So now you're embedding knowledge generation within organizations and practice. You're not just feeding in from the outside, you're enabling local learning, capacity development, co-production, fostering networks, encouraging collaboration, linkage, and knowledge exchange across disciplines and sectors to integrate diverse expertise and perspectives. So, linking your researchers with practitioners and really opening up those conversations. And finally, advancing knowledge mobilization. So developing theoretical frameworks and empirical evaluations to refine and strengthen the field of knowledge mobilization itself. So, some of these research papers that are talking about a more interactive and non-linear approaches are advancing knowledge mobilization. So I know it's a lot and probably too much to take in right now, but you can come back and look at this if you're interested. Look at the paper. So you've got these archetypes. Now, to finish, we've got our archetypes. So where might we use these with our systems thinking approach? Well, if you're going to focus on this level, then you might use producing knowledge and you might use getting research into practice at this level. If it's the feedback, probably brokering knowledge is going to be important here, and researching in practice. Relationships and power, well, fostering those networks will help, but also intermediation. And of course, structures and rules, you're advocating evidence, but also intermediation again. And if you want to leverage goals in a system, well, that'll be advancing KM and advocating evidence. And then of course, paradigm is advancing KM, again, shifting from linear to interactive, getting everyone to kind of see it that way. So systems thinking is becoming more and more popular in knowledge mobilization, also in implementation. Some are wondering, will it be a fad or actually add value? Well, I think that there is some good evidence for systems thinking, some stronger than others, but I think there's some evidence that if you take a strategy that does use systems thinking, they're going to be more powerful and more likely to get more impact. Because, when you use systems thinking, in theory, it should enhance your knowledge mobilization, allow you to address the complexity of public health challenges. It also encourages cross-sector collaboration and integrated approaches. There's also some evidence from complex health interventions. So a study of 124 interventions in chronic disease management, things like congestive heart failure, diabetes, hospital readmissions, found that better outcomes occurred when interventions targeted multiple system characteristics, like interdependencies between people, resources, and structures. And interventions were more effective when they evolved responsibly over time. Also, if you look at whole school and co-production approaches, these definitely are drawing from systems thinking and do seem to be more effective for things like tobacco use, sexual health, leadership, and organizational efficiency. There's some evidence that, systems thinking can enhance leadership performance and organizational efficiency, also improve project management and crisis response. Also evidence that systems approaches optimize knowledge use by improving access to organizational knowledge, co-producing research and fostering those collaborative networks, encouraging bottom-up innovation, scaling large-scale healthcare transformation. Well, again, there's some evidence that can support this. Some of the work around this is surgical process redesign, primary care improvements, quality improvement initiatives, process evaluations using systems thinking help explain the relationship between individual actions and broader organizational functions. Also, if you're trying to implement things, bringing in complexity science and systems thinking can really help us start to learn how to implement in the face of complex systems. So there are still some challenges, though. Despite some good evidence for systems thinking, most KM approaches still rely on outdated models. A global survey of 106 research organizations found most KM strategies use a disseminate and hope model, focusing on knowledge production rather than systems integration. And I have to say, you've kind of still seeing that myself in the systems I work in and across the UK, the EU, that a lot of KM still kind of sees it as, well, we need to just produce knowledge, keep producing knowledge, and then that's kind of it, and get it down into the system, rather than more of an integrated approach. Finally, KM often ignores competing definitions of knowledge, local context, and political influences, and few KM models incorporate systems concepts like unpredictability, emergence, and local autonomy. Wow, that was a long video than I was expecting. Anyway, I hope that's been useful. So I've tried to show you how, we've touched on what knowledge mobilization may be. We've talked about how it draws from multiple disciplines, also draws from different paradigms, and how all of these come together to create our KM strategies. One thing that's often missing seems to be systems thinking. This can potentially bolster your KM strategy tremendously. I've shown you that leverage model, so you can look across a system and think, where can we leverage KM the most? And we've also looked at the 8 archetypes for actual practices we can use to do that. So I hope you've enjoyed the video. If you want to get in touch, do reach out. If you're interested in implementation training, check out the links below. And I hopefully see you again soon. Thanks. Bye.